Hey and welcome to everyone who's watching this. In this video, we're discussing alcohol toxicity and its management. George, who is a 30-year-old guy, appears in most of his pictures holding a drink. He's obviously an alcoholic, but he doesn't take it seriously, even though it gets him in a lot of trouble. He can't find a secure job position or even maintain a serious romantic relationship with any woman he meets. But he's in a state of denial due to his inability to stop drinking. Alcohol may seem to be beneficial in the early stages of its consumption without abuse. But once the person becomes an alcoholic, it turns to be an alarming problem that may lead to dependence and toxicity. The most common symptoms of alcohol toxicity include confusion, inability to communicate, irregular or slow heart rate, hypothermia, and other dangerous symptoms such as respiratory depression, coma, and even death. If you believe somebody is suffering from alcohol poisoning, you should call for an ambulance and provide assistance until it arrives. You should try to keep the individual awake. Try to keep them in a sitting position, not lying down. If they are able to take it, give them water. If the person is unconscious, put them in the recovery position and check their breathing. Don't give them coffee, it will worsen their dehydration. Don't lie them on their back. Don't give them any more alcohol to drink. And don't make them walk. In hospital, depending on the severity of signs and symptoms, staff may just monitor them until their alcohol levels have dropped. A tube may be inserted into their windpipe to help with breathing. They may be given an intravenous drip to control hydration and blood glucose and vitamin levels. They may be fitted with a urinary catheter if they have become incontinent. In some cases, the patient's stomach may be pumped. Fluids are flushed through a tube that goes down their mouth or nose. If the patient, who may sometimes be a child, has unintentionally drunk methanol or isopropyl alcohol and has alcohol poisoning, they may need kidney dialysis to speed up the removal of toxins from their system. The perfect way to prevent alcohol poisoning is to avoid drinking alcohol at all. You can drink non-alcoholic beverages instead. But if you can never avoid drinking, you should follow some drinking strategies to keep you away from being an alcoholic or getting alcohol toxicity. You should stay with the same group of friends the entire time drinking. Use a designated driver. Eat before and or during drinking. Keep track of how many drinks are being consumed. Stick with only one kind of alcohol. Avoid drinking games. Determine in advance not to exceed a set of number of drinks. Have a friend that let you know when you have had enough. Alternate non-alcoholic with alcoholic beverages. Pace drinks to 1 or fewer per hour. If you follow these strategies, you will be more safe and it will be less expected to get alcohol poisoning. Thank you.